Welcome to The Explainer. Today, we're uncovering the massive, high-stakes logistics that keep an entire nation's healthcare system stocked, running, and most importantly, ready to save lives. You know, when we think about healthcare, our minds naturally jump straight to the doctors, the nurses, the sterile operating rooms, and those incredible life-saving procedures. But behind every single cured patient, behind every successful treatment, there's this invisible, highly complex architecture of logistics. So today, we're diving deep into the recently updated Uganda Essential Medicines and Health Supplies Management Manual. We're going to explore the exact strategic blueprint that the Ugandan Ministry of Health uses to ensure that a patient in a remote, rural community gets the exact medication they need precisely when they need it. It is a really fascinating journey of supply and demand with literal human lives hanging in the balance.
Okay, let's dive right into this with a pretty staggering fact. Essential medicines and health supplies actually represent the second largest expenditure in Uganda's entire health sector. They are right behind human resources. Just think about the sheer scale of that for a second. Managing a national health budget is an absolutely enormous task, and ensuring that this specific, massive investment is protected and utilized efficiently, well, it's paramount. The government of Uganda has a constitutional mandate to fulfill the fundamental rights of its citizens to access health services, but because financial resources are always limited, effective management of this budget isn't just about good accounting. It's really about minimizing wastage from overstocking or expiration so that absolutely every possible resource goes directly toward optimal patient care.
Part 1. The Healthcare Supply Chain. To truly understand how this massive investment is managed on a day-to-day basis, we really have to look at the very veins of the medical system. And it's so important to put a human face to all these dense, high-level logistics. Think about a frontline pharmacist carefully managing these life-saving stocks. The source material notes something really interesting. While pharmacists and supply chain officers receive foundational training in this area, lots of other healthcare workers who are responsible for handling these commodities actually do not. And that's actually the entire reason this comprehensive manual was developed by the Department of Pharmaceuticals and Natural Medicines in the first place. They needed to standardize the process, eliminate costly duplication, and ensure that every single person touching the supply chain, from the warehouse manager all the way to the dispensing nurse, has the exact right skills, knowledge, and attitude.
So, the crucial takeaway here is that supply chain management, or SCM, isn't just about moving boxes from point A to point B. It's a massive, multi-step lifeline. It begins with selection, deciding what to buy. Then comes quantification, estimating exactly how much of a product is required for a specific health program just to ensure an uninterrupted supply. After that, you've got procurement, physical distribution, highly controlled storage, and finally, appropriate use. The manual even introduces these brilliant strategic frameworks for when budgets get tight, like the VEN classification system. VEN stands for vital, essential, and necessary. It's essentially a triage system for procurement, guiding the country on how to prioritize quantities so that the absolute most critical, life-saving drugs, the vital ones, literally never run out, even during tough financial constraints.
Part 2. Selecting Essential Medicines.
So how exactly does a country decide which drugs to buy out of the thousands of potential options on the global market? Well, the essential medicines concept is this delicate balancing act between widespread public health needs and strict economic realities. As the World Health Organization defines it, and as Uganda has adopted it, this strategy is built on the observation that the vast majority of health problems can actually be treated with a relatively small number of medicines. Instead of trying to procure every single drug under the sun, the focus is placed on a curated list that offers the best efficacy, safety, and cost-effectiveness. In Uganda, this is formalized in the Essential Medicines and Health Supplies List of Uganda, which is meticulously aligned with their national clinical guidelines.
Now, you might be thinking that by limiting the national list to roughly 600 essential items, they're cutting corners, but actually, the entire system becomes vastly more efficient this way. Think about it from the perspective of a doctor or a nurse. When you routinely use fewer than 200 medicines, your clinical experience and your absolute mastery of those specific drugs skyrocket. It directly leads to better patient therapy. And on the logistics side, fewer items mean procurement is incredibly streamlined. Bulk purchasing drives those prices way down, and managing the physical storage in a local clinic becomes infinitely easier. It even simplifies formal education in medical schools. It's just a really powerful example of how intentional limitation actually expands the quality and reach of healthcare.
Part 3. Mapping the Lifeline.
Now that we have our highly curated list of essential medicines, let's trace the literal physical journey these critical supplies take across the nation. There is an incredible amount of coordination required to flow commodities and information from global donors all the way down to local community health centers. You've got international players like the Global Fund, USAID, and UN agencies feeding into the national hubs, specifically the National Medical Stores, or NMS, and the Joint Medical Stores. What's absolutely fascinating here is that Uganda is currently implementing a 10-year roadmap for health supplies self-reliance, aiming for the years 2022 to 2032. This roadmap is a massive strategic transition plan designed to increase local capacity to finance and manage this exact national supply chain, completely independent of donor support, ensuring real, long-term sustainability.
So we can break that complex web down into a clear, step-by-step journey. We can track a single box of medicine from those central national warehouses, cascading down to regional hospitals, then to smaller government health centers, and finally into the hands of village health teams out in rural communities. And at every single step, the storage conditions absolutely must be pristine. The manual details rigorous standards to protect these supplies from water, moisture, and even slight temperature fluctuations. They even utilize a methodology called the 5S steps: sort, set, shine, standardize, and sustain. This ensures that every single storage room, whether it's in a massive hospital or a tiny rural clinic, is organized for maximum safety, security, and efficiency. They also strictly enforce methods like first expiry, first out, or FEFO, to prevent tragic wastage.
Part 4. Preparing for emergencies.
But what happens when this carefully mapped, highly structured system faces its ultimate stress test, like a sudden public health emergency or a dangerous disease outbreak? The entire system has to shift gears immediately. A public health emergency, like an outbreak of Ebola, Marburg virus, or anthrax, obviously poses a substantial immediate risk of fatalities. To handle this, the supply chain operates in 3 distinct phases. In the pre-emergency phase, the focus is entirely on stockpiling medical countermeasures, or MCMs, at strategic prepositioning centers. When an outbreak hits, the system pivots to rapid deployment. And interestingly, in the post-emergency phase, they execute what's called reverse logistics, which is the careful decommissioning of temporary treatment units and the redistribution or return of unused medicines and equipment so that literally nothing is wasted and the system resets for the next time.
Notice the stark contrast in how things are run during a crisis. Unlike normal operations where supplies are systematically ordered through standard electronic logistics systems based on monthly consumption, emergency rapid responses completely bypass those regular channels. During a crisis, a multi-sectoral national task force takes over. Their logistics subcommittee tightly coordinates allocations directly to the district task forces based on the real-time, unpredictable dynamics of the emergency. It is a highly centralized, rapid-fire approach designed to push life-saving countermeasures out to the front lines without any bureaucratic delay.
Part 5. Ensuring appropriate use.
Finally, let's look at the absolute most critical part of this entire journey: the exact moment the medicine is actually handed to the patient. Because honestly, it doesn't matter how perfect the logistics are or how pristine the storage is if the medicine isn't used correctly at the very end of the line. There is a deeply complex web of human behaviors that dictate proper usage. You have prescriber factors, like acquired habits, pure relationships, or maybe a lack of formal training. You have patient factors, like cultural beliefs or intense demands for specific treatments, like wanting antibiotics when they really aren't needed. And you have industry factors, like misleading promotional claims. It is a perfect storm that can lead to therapeutic failure, dangerous resistance to medicines, and massive financial waste if it isn't carefully managed.
To combat these massive risks of medicine misuse, Uganda's pharmacy department heavily relies on core World Health Organization interventions. It truly requires a multidisciplinary approach. They enforce strict adherence to the Uganda clinical guidelines we mentioned earlier. They establish medicine and therapeutics committees in hospitals specifically to monitor prescribing habits. They ensure there is independent, unbiased information available on medicines, totally free from industry influence. And they heavily prioritize public education. The ultimate goal here is to ensure the 5 rights of dispensing: the right medicine, given to the right patient in the right dose, at the right time, with the right information.
As we wrap up this explainer, I want to leave you with this thought. We've traced the incredible, wildly complex life cycle of a nation's medical supply, from high-level policy and global procurement all the way down to the very specific human behaviors at a local clinic counter. The next time you pick up a simple prescription, whether it's for yourself or a loved one, take just a moment to consider the invisible global lifeline that put that medicine right into your hands. Thanks so much for joining me on this deep dive, and keep asking the big questions about the unseen systems that shape our world.